So in 2013, I went to a GP with a non-healing ulcer in my mouth. He sent me off to a specialist. I was living in Canberra at the time, and he said, we'll get it sussed out, but you'll be fine. Those were his exact words. I went to the maxillofacial surgeon who looked in my mouth and he said, you're young, you're a non-smoker, this will be hyperkeratosis, so increased skin formation on your tongue. We'll cut it off, you'll be fine. As I said in this morning's session, when he got the report, he clearly hadn't read it already, and as he walked down the hallway, he stopped like that and kept walking. He said, follow me into my office. And he sat me down and he said, it's not cancer, but it's pre-cancerous. But we'll cut it out and you'll be fine. So a wider excision and a lot of pain and pain meds later, I walk into his office and he's like, the margins aren't quite clear, we're going to have to cut out more, but we'll do that and you'll be fine. Cut it out, I go back. It's just mild dysplasia this time, but we're done like butchering you, so we'll just monitor it. Oh, if you can record it, cool, too easy. All right, keep my hands busy. All right, and so went back to him, mild dysplasia, we're just going to leave it and monitor it, but more likely than not, it'll go away. Fast forward through 3 years of chronic pain and anxiety later, and I walk into John Charles Hodges' office, an ENT here at Memorial Hospital, and he looked in my mouth and he said to me, it doesn't look right. We're going to need to have another look at this. And the great thing was, I'd planned that session, because I'd been seeing him a little bit before then, to walk in and say, it doesn't hurt like it used to, but it doesn't feel right, and I want you to re-biopsy it. So immediately I was validated. Him and I were on the same wavelength. So, we went through a biopsy. And for those of you that don't like blood, sorry, I lived through it, you can look at it. So, the middle picture is my tongue before the biopsy happened. And then, look, the bleeding and stuff down there, that was just a little mishap. I woke up one morning covered in blood, and I didn't realise till I walked to the bathroom mirror. And then also, there was a slight mishap at 2 a.m. where I had to go to emergency to get all that bleeding sorted out. But a great time. But the best part was, about all of this, was that after I was told it doesn't look right and it was going to get cut out, and as I said this morning, in the recovery room after my biopsy, JC came up to me and he said, just looking at it and feeling it, I'll give you 50-50 if it's cancer or not. I'll see you in a week and we'll go from there. So lo and behold, I walk in a week later and he closes the door. I was the last patient of the day, so I knew I was in trouble anyway. And he closed the door behind him and all he said was, good thing we cut it out because it's cancer. And then we spoke for about 40 minutes and he laid out to me exactly what the plan was and how we're going to deal with this. So I had surgery, and as again, I said this morning, neck dissection, just a lazy 47 staples to keep that together, a partial glossectomy with a buccinator flap. So for those of you that can't quite make out that bottom left-hand picture there, that is literally part of my cheek stitched into my tongue. And I had that kept there for a month. I spent 2 days in CCU with a nasogastric tube, which was the best thing ever. I never had to eat. And I spent another 6 days just in the general ward before they let me go. But then on the last day, I was told that I was going to be tortured for about 6 weeks. And I can only liken radiotherapy to being waterboarded. You honestly feel like you are being suffocated. Like someone's either just gone, I'm going to put a pillow over your head and smother you, or I'm just going to like push your head underwater and keep you there. It was an absolutely mortifying experience. And again, as I said this morning, the radiotherapists did a great job with me, but no matter what they did, this is still not pleasant. And I hope none of you ever have to go through this, though obviously you're probably going to see a lot of people going through this. But what also made that quite terrible for me was the fact that, as I was saying, I've to this point gone through 3 years of being told I'd be fine, to 3 years ago being told I was fine, to 3 years of just pain and nothing really happening, just people checking me every now and then and going, nah, it looks all good, you're right to go, to then being told, you've got cancer, we're going to cut things out and then we're going to irradiate your face. So pretty traumatizing. And then on top of all that, so we're going through the symptoms here. The mask itself, disastrous. As I said, they tried to make 2 because you can see there that one doesn't have the mouthpiece in it. They tried to do the mouthpiece on the second one, but I couldn't go through with it. I had to tell them that it wasn't going to happen, and they were fine with it. So, but then all the burns, the hair loss came in. I did take daily photos of myself and just started having fun just pulling whiskers out of my face quite easily. And then all the burns kicked in as well, and I was living on cocktails of juices and oxycodone, basically, and ended up on fentanyl by the end of all this. I was wearing fentanyl patches, and I didn't realise how good fentanyl was until 24 hours after I stopped wearing the patch. But then all the internal stuff as well. So again, I lived through it. You can look at it. This is the inside of my mouth. We had, again, internal burns, blisters, ulcers. I ended up with thrush. I lost my sense of taste for the best part of 6 months from all this. Dry mouth issues, which I still have to this day because half my saliva glands don't work. And the inability to talk, the inability to swallow. Like, I was rinsing my mouth out with a methacaine, and for those of you that aren't familiar, that is just a local anaesthetic that worked for about 20 minutes or so that allowed me to eat or maybe have a phone call with someone. I lost about 13 kilos through the whole experience, gained all that back. Thanks, guys. Which was a good thing because my doctors actually said to me, they're like, can you make sure you put all this weight back on or put on as much weight as you can before treatment so you can tolerate it better. But I knew all these symptoms were coming because my radiotherapist, my oncologist, my ENT, they all kept me in the loop of what was to come. So I was prepared for this. It was still shit, but I was prepared, and that made the world of difference. So just something else a bit nicer to look at. These are my friend's dogs on the left there, and that's Barry the kangaroo. He's from the Northern Territory, so representing them here today. But the one thing you've really got to remember is that you're going to engage a lot of different people at a lot of different stages in their life. And I know I'm focusing on the cancer aspect, but the medical imaging people in the room, I've not forgotten about you. You're going to come across people with chronic illnesses, uncertainty about what they're getting scans for, certainty about what they're getting scans for. Like, I recently just went through my 2-year review, so having my contrast CTs all over again for the 5th time. But it's important to take the time to understand a person's story. I pretty much gave you up to, the radiotherapy was 4 years of story in about 4 minutes. It does not take long to get insight into someone's life, who they are, where they're coming from, and why they feel the way they feel. And all you've got to do is listen. And you've done that so well this morning. So thank you. But and this was touched on this morning, and it's really nice that a lot of the things I had to say have already been discussed. As you do this over the years, you will, to some extent, become desensitized and maybe a little detached from what you're doing, because you'll be doing this so often, day in, day out. And again, this was said this morning, but the person on your table may be going through this for the very first time, and you need to remember that. You can't tell them it'll be okay, you'll be fine. You need to listen, understand where they're at, and work with them to get the best outcomes for them while still being incredibly proficient at your job. So what shouldn't you do? My best advice is don't be a dick and don't be a dictator. And these are things that were said to me throughout my cancer experience, before, during, and after, that stuck with me. And to really harp home the point, it is the little things. Globally, you will do a great job, but it's the things you will say in passing or the little things you will do that will make the biggest impact on people. You were vomiting, said the nurse who injected me with anti-nausea meds without asking my consent first. She assumed I was vomiting, but I was actually drooling into a vomit bag because my tongue and my cheek were stitched together and swallowing was incredibly difficult. You must be in pain, said the same nurse who declared to me that before she'd leave her shift, this is within 48 hours of my surgery, that I would have pain meds because I was in pain. I wasn't. Pain is a subjective experience. It is not up to her to decide how much pain I was in. You're too young to be here, sadly, was said to me by the 92-year-old man in the waiting room of the radiotherapy clinic. And like, no shit, I'm too young to be there. Sorry that I'm swearing as well. They'll tell me off later. But you've also got to remember that whilst you're communicating with them, so are a lot of other people, and it's happening in your waiting room. There are people that are reinforcing to me, making me feel terrible because I'm like, yeah, you're right, I am too young to be here. And the clinic I was in, I was actually the youngest patient in active care at that point in time, with the next oldest person being about 20 years older than me quite easily. You don't realise how much pain you're in was something not my normal radiation oncologist, but another one had said to me because he was on holiday. You should look up the research of some masseuse that's developed a technique to get rid of cancer out of people. Yeah. You should look up black salve, because when I use that on my skin, I can feel the cancer cells getting pulled out of my skin. This is literally what someone said to me. Black salve, for those that don't know, was actually banned for use in 2012. It has absolutely no therapeutic benefit for cancer, and if you ever hear those words, quickly slap that person to get them back in line. And even as early as last week, I had another conversation with someone about this talk I was giving, and they got onto, oh, you should look up this like integrative therapist, gypsy, fish slapping person. That's all I heard, because like I just switch off now because I'm like, I don't care. This isn't like, anyway, it's not evidence-based, so let's ignore that. You're okay, you'll be fine now, and it must have changed you as a person. People were putting the pressure on me to, one, stop talking about it, because it was 3 months since your treatment ended. You're totally okay now, right? It's 2 years post-treatment and I'm still recovering from the radiotherapy. And you'll be fine. Again, people just love using that phrase. Internal optimism, but it's not your job to enforce optimism on that patient. It's your job to instill resilience. And it must have changed you as a person. I understand why a lot of people would think that traumatic experiences might engage something in us, that we have this rapid change in personality. But why can't we just also appreciate that it really galvanizes a lot of attributes that your patients are bringing through the door day in, day out? Again, you listen to them and engage with them, you'll be amazed the things people have been through before they've ended up on your table, and they haven't changed a bit. They're just the same person on steroids. But what were the good things that happened? And I'm going to hurry up here because I realize I'm going to run over time. One of my radiotherapists, Lauren, it was the small things. She put a post-it note on my weekly schedule to apologise for giving me a 7 a.m. appointment when all my other ones were later in the day. I had to catch 2 buses to get to my appointments there, and 2 buses there, 2 buses back. But she thought of me. She took 10 seconds to go, I'm not going to see him, I realise what I've done to him, but I'm sorry and I'm thinking of you. Great. I didn't care about all the other stuff they were doing at the appointments. They were doing their job. But the fact that I knew, even if they weren't engaging me at that time, they still cared. The radiotherapist who was listening to me when I said that I felt like the mask was blocking off my nostrils and I couldn't breathe went, give me 30 seconds, I'll cut out a hole in that mask for you. Immediately could breathe better, immediately could tolerate that mask so much better. Just by that hole. That's all it took. 30 seconds for someone to listen, take action, done, great. And we carry on. Again, I knew that they cared. I had my ENT call me. He visited me every day I was in hospital, except for one day. And he said, sorry, I'm not coming in today. It was a Sunday. I've got to take my kids to sport and do family stuff. Like, heaven forbid. But he still went, I better just let him know that I'm thinking of him and that, you know, I'll see him again tomorrow. Great. So you really got to take little opportunities to show you care, but also find out what's motivating people to get through what is a terrible experience. Whether it be attending a rock band concert a week after, favourite band ever, Guns N' Roses, went a week after my treatment ended. I was terrible. I was so high on fentanyl, but mind you, so were most of the people at that concert, I reckon. But the point is, that was what was driving me. I'm like, I just can't wait to go to this. I nearly cancelled going because I was just terrible, but I still went, and it was great. And then a month later, attending my best mate's wedding. As well. These were the little things in the back of my mind, always like, just get through this and you've got something to look forward to and it's going to be great. So along with motivation, listening, taking initiative, and just doing the little things, do it with a sense of humour. Or as my friends like to point out to me, bit of tongue in cheek. That's all it takes, guys. Yeah, I know, right? We got there. It was a long walk. Trust me, that's not even close to the worst thing my friend said to me during this time. But find the humour in it. Have fun with it. Because, again, if you're not doing that, you're going to be pretty miserable and the patient's going to be pretty miserable. So my final thoughts on this are really quite simple. I like alliteration, so I've gone with clinical competency and communication cultivates confidence. You will be excellent at your job. You will be proficient in delivering the modality that you're trained to deliver. So focus on the communication side of things, how you're going to engage people, how you're going to make their life easier, and how you're going to make things fun. Since 2013, I had 109 separate interactions with health professionals that I could remember. 101 of those in the last 3 years. That's a lot of opportunity for a lot of people to do small things. So don't think you've got to be doing it all the time, but always be looking out for that opportunity. Don't ever dictate an experience when there's opportunity for learning. Much like those people that declared statements at me of how I must be feeling or how I must be going was quite alienating and quite isolating, because suddenly I'm like, well, I can't tell them how I feel because they've already decided on my behalf, and really don't want to argue with them because this Amethicaine's going to wear off in 30 seconds and then I'm going to be in a lot of pain and sleep for 18 hours. But really just take the time to learn, find out the why, find out what's going on, and it does not take that long. Be the post-it note in somebody's day. Take that 10 seconds. And there's a great line in Deadpool, for those that have seen the Marvel movie, where Colossus says to Deadpool, being a superhero isn't a full-time job. All it takes is 4 or 5 moments. And that is quite literally what a lot of my specialists did throughout my care. They took moments to do something above and beyond that brought them so much goodwill from me. They did no wrong. They did not step out of line at all over the years that I've been undergoing treatment and post-treatment care. And again, have fun with it, guys. I now work for Camp Quality as their program coordinator in South Australia. That is me in the Hulk costume, dressed up there. And we have a thing called fun therapy, and those icebreakers are great. So doing those little things just to change the mood can make a big difference to you throughout your careers. So thank you for listening. Please feel free to come and talk to me. There are so many things that I could tell you about this experience that I couldn't even touch on today just because of the time limits. But please know you guys are going to change a lot of lives, and you may never understand the impact you have, because you'll do your role, people will move on, and you'll never hear from them again. But know, and I can tell you now from the work I do with Camp Quality, you make a huge impact. Absolutely huge. So thank you.